Welcome back to Care Decoded, the show where we simplify the complex world of documentation, coding, and clinical AI to power better care. I'm your host, Sunil Nihalani. I'm the CEO of InfoScience and also a practicing internist and gastroenterologist. So today I'm joined by Dr. Stella Onuoha-Obilor. She's a nationally recognized leader in clinical quality and population health. And she's also a healthcare executive whose work has transformed clinical quality ratings. She's optimized value based programs and built systems that put patient outcomes at the center of performance. That's quite a resume. So, Dr. Stella, thank you for joining us.
Thank you so very much, Dr. Sunil. Thank you for having me, and I'm honored to be a part of this discussion. Thank you.
Great. So, today with Dr. Stella, we're going to be exploring how data, leadership, and human insight are converging to reshape what quality and population health really means in 2026 and beyond, and how organizations can move beyond compliance to reap clinical transformation. All right. So we'll start with talking about how quality is being redefined in the value based care era. So, Dr. Stella, you've led organizations that have consistently achieved high star ratings, 4.5 to 5, which in this day and age is fairly rare. Most health plans aspire to, but find it hard to achieve and then even more hard to sustain it. So with CMS introducing new measures such as, kidney health evaluation and physical and mental health maintenance, thereby, shifting weightings away from patient experience to outcomes and increasing the scrutiny of health equity and social determinants of health. What has changed in how we define quality in the value-based care era, and how are those definitions evolving under these new expectations from CMS?
Thank you, Dr. Nihalani. That's a great question. And I'll begin by saying that it's timely that CMS is redefining the metrics, the measures. And why they're doing this is to ensure that we move away from the mindset of seeing quality as check the box, right? We are moving into the real deal of keeping individuals healthy, of looking at quality not just as compliance only, but as a business strategy. And I said that to say this: you can be 5-star plan, but your population is sick. Then you have not done so much. And that is why CMS is moving away from process into improving the outcome, so that organizations will ask themselves, where are we today? Have we changed our mindset of asking questions like, how did we perform? To a question like, how do we help our population today? Real-time data, using real-time data to improve the health outcomes. And also CMS and CQA, they are all putting much focus today on what I will call whole person care, meaning that you're looking at individual, not just the clinical episode, but individual as a person, as a whole, right? And looking at the health disparities, because health equity, it's quality. There is no quality without equity. And if you do not know your population very well, if you do not know the drivers of care, the cost of care, then that means that you do not know also that you can use the data you have, break it into insightful information that will help you develop data-driven high-impact programs that will continue to make your population, the members that you proudly serve, so that their health outcomes will be continuously improved. If you cannot measure it, you cannot improve on it. And that is why health equity itself, it's measured. It's no longer optional. So organizations are moving away from those days that you check the box and that's fine. But today, we have to go beyond closing the care gaps to asking ourselves, what impact are we making? And how is the population doing? How are your members doing? So everyone is in alignment that is timely. The changes that have come, they are all timely, and that will make us shift and change our mindset and believe that, I always tell people healthcare is local. It is. Because you need to understand your population. You need to know the disparities that exist and also know how to close those gaps for you to be outstanding or have reputation that everyone will look at and said, that is the health plan that I want to use. That is the doctor that I want to return as my primary care physician, or even ordinarily, this is where I need my friends and families to be treated. And that's why everyone will agree that today, the direction that CMS is moving is timely, it's needed. In fact, it's long overdue. We need to move away from checking the box with only thinking about numbers. Metrics and KPIs are not enough. But how do we measure the impact? And how do we measure the outcome? How do we use those numbers and make it make sense to the individuals that we serve?
So, and that was going to be my next question. How do they move their mindset from, just checking boxes as opposed to using the star ratings, HEDIS, and CAPS as strategic tools, right? So, it sounds like what I heard from you was it needs to be a data-driven approach to understand the members and what the needs are really more than anything else, right? It's all part of the same equation, but is there, other than looking at the data more closely, is there anything else that comes to your mind in terms of shifting an organization's mindset to do what we just talked about, and what CMS wants?
Yeah, thank you very much. And yeah, it's not enough even to look at data, right? If you're looking at an individual, you need to know what their care journey looks like. You need to know what is their medical neighborhood. When I say medical neighborhood means all the treating team. This individual, the pharmacy they go to get their prescriptions, the primary care physician, the specialist, that cardiologist that this individual goes to, all the claims, the journey, the care journey, right? When you look at that data, then you need to break the data into actionable insights that will help you personalize the care that this individual will receive. Because I say all the time that no two human beings are exactly the same. If we are not in that space that we personalize care and bring it to the individual that we are dealing with, chances are that we do not know them very well. We do not understand where they are at that care level, the care level where they are, so that we can bring high data driven, high impact programs that will make them live healthier lives. And again, remember, it's not only data, leadership and culture will come in. Because when you are talking about data, leadership shouldn't see data as only a compliance tool. They should look at it as a strategic asset, meaning that every stakeholder will understand that you need data-driven team with a mindset of continuous performance improvement to go beyond just data itself. Take, for instance, if I see a primary care physician that what this doctor is doing all the time is to look at the computer and not look at me, right? Meaning that this doctor has more admin time than face time with me. So there is no time to build relationship with me. There is no time for me to even ask questions of how am I today? What are the conditions that I have? What should I do? And what will happen if I do not do those? So now you see, it's not only about data, but the human aspect of the relationship that should exist before individuals will be cared for as a human, as a whole person. I strongly believe and advocate for whole person health. That is the era where we are now. And even in the next 5 years, that's where we want to be, whereby everyone will work together, all relevant stakeholders will understand that it's not just data. It's about cultural shift. It's about leadership. It's about empowering the team to understand that we are in the business of making individuals live their healthier lives.
Yeah, I think what you're saying, Dr. Stella, is that there needs to be a lot more deeper insights in terms of what the patient's needs are. And then the whole team needs to take care of that, including obviously starting with the physician. So that definitely makes sense. So, just continuing on that thought, you have previously emphasized that there's definitely an overlap between clinical quality and population health. That's kind of what we are talking about. But leading from that, how do organizations bridge the gap between the various teams, right? So they have quality team, they have care management, including providers, and then you have utilization management. So how do you create a unified approach to improving outcomes that we are talking about here?
Yeah, thank you again. That's a great question. And I the way I define quality sometimes, I tell people that quality is everybody's responsibility. It's a contact sport. You never win by being standing alone. For us to understand that in the world or space of population health, every voice matters, right? Because whether it be the leadership will understand that when you have strategic goals, that everyone would have to align for you to be successful. The IT team, we need to, the clinicians will need to trust the data for them to use it. And then there has to be alignment between the IT team and quality teams and even the clinical services, UMCM, disease management, right? But again, one of the things that will cause disalignment will be when people do not trust the source of data. When there is no transparency, then people begin to have doubts about using data to make decisions. But that is why every organization that want to break the silos and make it be a more of blended care, you need to be transparent with your data. There has to be established valid data governance. There has to also be a centralized data, whether you want to call it a single source repository, whereby you will be able to know what comes in, what goes out, and everybody will understand this is the data we have, the source of the data, it's valid, and then you have to agree on who owns it, because that's another question people often ask. Who owns that data? What will you use the data from? And how do we track it to know what our progress, where we have made progress, where we have used it to impact the outcomes that we are looking for? Because at the end of the day, you are working together as a team to improve the health outcomes of the population you serve. Whenever you are working in silos, you will be creating more work, there will be duplicative work, and at the end of the day, you will not achieve your outcome, which is impacting the health of the people you serve. So there has to be that working together as a team that I said at the beginning, that it's a contact sport. You're not alone. If you think that quality is something that one individual is standing, it's not going to work. It has to be everybody's responsibility. It has to also be a contact sport for you to make meaningful impacts in the lives of the population that you serve.
Absolutely. Yeah. So I agree. I think team approach and data integrity with transparency. That's the message from this that you're giving us, right?
Yeah.
Yeah. Thank you. All right. So let's move on to talking about precision data and the future of measurement of data. So the industry, as we know, is definitely moving from volume to value, but also from aggregation to precision. So, given that, what role do advanced analytics, AI, and real time data play in driving a more precise understanding of population risk and care quality?
Great question again, and thank you for that. And I will begin by saying that, healthcare delivery system and organizations are moving away from what used to be retrospective measurements to proactive intelligence. And what will help you, succeed in that space of moving into proactive intelligence is using your data to be more proactive, predicting the population that you serve, understanding your population. Who are your key drivers of cost, right? You need to understand risk classification. Who are the high utilizers? Who are the frequent flyers to ED? Who are those that, in fact, high risk, high cost, high utilizers? Define those. And you cannot just define that without utilizing AI this day and advanced analytics, right? And then when you have done that, you also have to understand that historical data is as much important as the culture itself, right? If you look into your data, you should use your data to tell a story, a valid story, a reputational valid story, in the sense that you understand the population you're dealing with. You're using your advanced analytics, you're using your predictive models or whatever logic that you're using to predict. Take, for instance, if I looked at an individual who frequently uses emergency department for even avoidable causes, right? Then chances are that I predict already, and for me to predict that this individual will continue to use emergency department, it's not enough. But what can I do to ascertain that I will ensure that this individual will utilize the resources that are available instead of going to ED when they are not supposed to use the ED? Or even if you're trying to reduce or prevent avoidable admissions, using your data to understand who are those that were previously admitted, why were they admitted, and why were they even readmitted? So the data now, it's giving you that knowledge that you would not have had. And when you have that insight, those will help you to understand the way to develop the programs that will help the individuals that you care for. And that will also help you to have control over giving the right care at the right time and at the right level of care. So I would say that data is everything when it comes to healthcare delivery system. But again, it has to be actionable, real-time data. Because now we are moving away from the era of after visits to after claim to after the measurement. We need to be more proactive and use real-time data to stop even those visits from occurring if they're not supposed to happen. So that is why today interoperability means data means at all times when it comes to healthcare delivery system.
Yes,
Yeah.
exactly. So yeah, basically what you're saying is, so data is a very valuable tool, but the tool's output has to be acted upon, right? Which again is not easy, but it needs to be done, right?
Absolutely, yes.
Yeah, yeah. Good. So yeah, you mentioned interoperability, right? So my next question is related to that. So you have worked on interoperability and AI-driven data acquisition. So in your experience, what is the biggest barrier preventing organizations from fully harnessing the power of integrated data, and how do we solve it?
Thank you, Dr. Nihalani. Good question. And I'll begin by saying that whenever that we mention interoperability, people think that it must be data, it must be challenged related to data. But I will start by saying interoperability challenges also include processes and people, because many organizations today and even health systems, they have moved pretty fast in areas of technology. So today the challenges that we are having are in areas of alignment and trust as versus technology. People have used advanced analytics, they have utilized AI and continue even to utilize AI in this era, right? But again, the struggle is still within alignment, trust. Where is the data coming from, right? Who are we sharing it with? How do we protect even the information that we are sharing? And at the same time, the big challenge is clinicians, do they trust that data? Because if a clinician did not trust the data you're sharing with them, the clinicians do not trust the data, the IT is not in alignment with the quality teams, and then the leaders or the senior leadership are seeing data as only compliance tool and not as a strategic asset, the benefit of data will be lost in the translation, because now people are translating that data in different ways. If we do not understand exactly what we need to use the data for, how do we use that data to make impactful decisions, and how do we even protect the information that we have so that people can continue to trust us with their information? Those are where the challenges today lie. And for us to overcome these challenges, number one, we have to move away from data ownership to stewardship, understanding that this is the source of truth. This is where we get it. Transparency. Clinicians will have to understand where the data is coming from. There will be alignment between the IT and the quality teams. And again, we shift from the mentality and mindset of just seeing data as compliance tool. We need to use it to meet our targets, our metrics, or the KPIs, but understand that behind every data point is a human story. That's the mindset that every organization should have. And the mindset, again, underneath that mindset is a mindset of understanding that your quality, your data, is not just only there to make you meet up with your regulatory requirements or compliance, but it's your business strategy. You should invest in it. You should find a way of telling that transparent story of what the data stand for, the decisions that you will use them to make, so that everyone will be in alignment and trust the data, and know that it's an asset for everyone. It's a shared resource, right?
Great. So sounds like, years ago, even just a few years ago, the issue was that data didn't flow as well, right? The acquisition of data was a challenge. It sounds like what you're saying is that that is not as much of a challenge as that we maybe move past it. And now we are moving to the next stage is how best to utilize the data, how to trust it, how to protect it. Is that right?
Absolutely. We have made huge progress when it comes to transferring the data. But today, let us not forget that trust is important, alignment is also important, so that the benefit of data will not be lost in the translation.
Okay. Yeah. So we've made progress, but there's still lots of work to be done.
Mhm. Yeah.
Okay, so as we look towards next year, which is pretty near, how do you see the role of clinical documentation evolving? Will it continue to be reactive, or will real time intelligence finally make documentation a proactive quality tool?
Great question. Thank you. A source that I am very passionate about. Well, I will tell you that documentation in the next 5 years, even as we are today, it's continued to evolve, continue to be better. And the organizations that will really tap into the benefit of adequate and proper documentation will be the organizations that are proactive. We do not only look back to what happened, how was care given, but we need to be real time, right? Real time, so that even before an individual goes to the ED, you already know that their blood pressure is high. There's a way to monitor that. There's a way to get across to that individual and find a way to solve that problem before it becomes crucial and critical. So documentation is moving into the space of real time, proactive versus being reactive versus being retrospective. Because for an individual to live healthy, you need to use the data that you have to look into the future and treat them sooner than later, right? That is the only time that, and again, when it comes to healthcare delivery system or quality space, risk adjustment, or even HIDIS, proper documentation is foundational. But again, real time, we are not waiting until after 1 year for us to know that someone who's diabetic, the A1C was more than 9. At the end of the day, you may have closed the gap because you know the value. The individual has gotten tested. But you ask yourself, would it not have been better if you knew 12 months ago that this diabetic has A1C of 9 or 10. That's where real-time documentation comes in. And for you to reap the benefits of preventive care, which is always better and cheaper and safer. So organizations should find a way of solidifying their data infrastructure and documentation today to make it more real-time and actionable, so that gaps will be closed more critical and on time, other than looking backwards or how do we solve what we did a year or 2 years ago. At that time, the deed is done. If an individual who was poorly managed, many complications must have set in. It's about being real time, being proactive, using actionable data to be more proactive is the key and foundational.
Absolutely, and has real impact on patients' health, which is what all this is about at the end of the day,
Yeah,
right?
yeah.
So let's talk a little about leading change and building a culture of excellence. So you've led major transformations at big organizations such as Highmark Health. So what is the key to building a culture that can sustain high performance and not just achieve it once?
Thank you so very much. And anyone who knows me will tell you that I am a transformational servant leader, someone who believes so much in leadership, coaching, mentorship, empowering and inspiring my team to be better and do better. So I am always an advocate of, remember, when you talk about technology, people, process, right? You may have the best technology, you may have redefined or streamlined processes put in place, but if you do not have the people that will translate your ideas into creative initiatives that will give you the outcome you're looking for, you still will fail. So why am I saying that? We need to, as we invest in data, as we invest in technology, we should never neglect the people, because the aspect of having people with a mindset, data-driven team with a mindset of continuous performance improvement will give you competitive advantage. So organizations that are winning today that will continue to win are organizations that do not neglect their people, value them, empower them, trust them, allow them, create a culture of continuous performance improvement, but at the same time, create and nurture a psychological safe environment that will allow people the opportunity of being, let me say, taking risk, calculated risk. Because we are in a space that before you establish any initiative, you're doing it for the first time sometimes, right? And if that person do not have that culture that they believe that it's okay to make mistakes and learn from your mistakes, then we will not be making any progress. So leadership, it's very needed. Good leadership, transformational servant leadership is needed both for anything and everything population health strategy and quality. We need leaders that can influence the team members. We need leaders that will mentor, coach, and inspire team to have that continuous performance improvement mindset. A leadership that will make people understand that quality is not eventful, it's everyday life. Excellence has no cap. Even if you're a 5-star today, that is when the work began for you, because you need to work extra hard to sustain the best practices. So let's look at the people that do the work, to invest in them as much as we invest in data and technology and processes that we redefine.
Sure. So basically, what you're saying is having the right leadership who create the right environment for the team to basically excel at what they're doing. That's how you have a sustainable culture. So if you had to coach a chief medical officer or VP of quality who are stepping into the first major value-based contract, what would you tell them to focus on in their first 90 days?
Another great question. Thank you, Dr. Nihalani. And I will begin by telling such individuals that in your 90 days, your 90 days into the contracting, they are not the time to fix everything. In your first 30 days, you're looking at your contract, understanding your contract, right? You are studying what are the attribution logic, what are the risk involved, what is expected of you. You also building relationship. You can never be successful in value-based contracting without building relationship, providers, getting the leaders involved. The front line also will have to be involved. And when you do that, it's also time for you to define what is being measured. Because remember, I said that it's not a time to fix everything, meaning that if you are going into this contract, there has to be focus for you. There has to be defined strategic initiatives that you're looking at. Maybe you're looking at preventing admissions, avoidable admissions, or maybe you will look at disease management, or even you want to look at preventative care. Yeah, so the 30 days will be a time to understand, and I say it the way that I usually tell people when they seek my opinion and my expertise. I tell them, in your first 30 days, diagnose before you prescribe. I haven't seen any physician who immediately a patient walks through your office, you're writing prescription for them. No, you need to diagnose first before you prescribe and treat, right? So you're understanding your contract, what is expected of you, even reporting cadence, how often do you report? What are your KPIs and metrics that you will report that will help you track your progress? And even what are measures? What are being measured? And what will be expectations of you? So when you understand that in the first 30 days, moving into your 31 to 60 days, that will be when you focus on the few that matter. You are not doing everything at the same time, but you need to set at least 3 strategic initiatives for you, 2 to 3 goals for yourself that this will be what you have to achieve. And again, you might even start seeing some easy wins. How are you closing the care gaps? How are you utilizing the data? What dashboards and KPIs will you use, right? Scorecards to track individuals' performances. And continue also to communicate. Communication is the key, and it has to be up and down. The frontline staff or people who are doing the work should not be left aside. And leadership will also have to, you have to transform the leadership vision and make it to align with the operational workflows that you're going to create or have. And then finally, in the 61 to 90 days, there are some wins that you want to showcase. There are some use cases that you've already established and how you've been able to be more proactive in closing some gaps. But again, every leader, when it comes to value-based contracting, should understand that you need relationship, you need trust, you need to have transparency. Use your KPIs, your metrics, to transform them into transparency so that when you are speaking to every provider or any provider, you're able to tell them the value proposition, because that's where people fail. If you do not tell me what is it in it for me, what is in it for me? If I do not understand value proposition, chances are that I will not give it my best. So that would be my advice. But strongly, they should understand that 90 days and when to fix everything, but when to build relationship, transparency, and establish what you will measure, how you will measure it, and also create a bridge between the pain points of the metrics and the reality. Because if you are far away from clinical practice, you may not understand the pain points of providers. How do you bridge that real-time pain points with the metrics or the real life, right? So that would be my advice. But relationship and trust will always be what I would tell anyone who is going into value-based contracting.
Thank you. Yeah, that's a very nice, I think, specific kind of roadmap you are giving people for the first 90 days. So thank you. I mean, hopefully people will find it useful. All right, so let's move on to the last part. So the road ahead, quality as a catalyst for transformation. So many in healthcare talk about AI and automation, but very few talk about how these tools can humanize care by giving clinicians back time, improving trust in data, and reducing complexity. So, how do you see technology truly enabling compassion in care delivery? So, I guess compassion for the person delivering the care more than anything else, right?
Yeah, thank you so very much for that question. And you see, that is why, remember, we started from triple M, quadruple M, and then quintuple M. And quintuple M because we said, hmm, why are we talking about quadruple and triple? And then we are not remembering providers who are giving the care. So with the quintuple M, we added provider satisfaction because now, if a provider is burned out or burned down, they are not going to give the best care to individuals. So what's optimization, standardization, innovation, and then redefining health? They are to the level that it will add satisfaction and joy back to practice. So that even a physician wakes up in the morning and he is or she is very happy to see patients that day because there's a reduction in admin burden, there is a reduction in admin time, there will be increase in face time. Every provider should have enough time. Every clinician should have enough time to have that face time with individuals that they care for so that they will build relationship, so that human will be added back to practice. Human beings are not treated like medical records because every human being, they have their own, what they are dealing with, what they are facing with might not be exactly the same. And again, that comes back again to how do we care for people to the level that we understand other drivers of health that is behind the clinical symptoms that they present when they see us. And all of this will not happen if we do not redefine health, if we do not remove redundancies, if we do not create extra time for clinicians to have more face time and have reduced admin time. So now you see that AI, generative AI, and the new way of redefining health, it's going to bring back joy in practice and add human into clinical care. And that's what we are looking for. Yeah.
Absolutely. And speaking of that, I think a couple tools that sort of come to mind. I mean, one technology which has taken root very rapidly and fairly widely is ambient scribes, right? So just letting the AI, and frankly, I use it in my practice, and helps me do a better job of documenting as opposed to me typing or dictating. It's already putting things into that I frankly did not used to have in my notes because I didn't have the time to do it. So I think that has been quite an improvement. And then, even as we talk about other administrative things that we ask providers to do, like risk adjustment coding, right? Which is a whole different world compared to actually taking care of patients. So having tools like, even at InfoScience that we've built, the HCC assistant, which can give them pinpoint sort of suggestions which are accurate, which they can act upon very easily. That, so even though they have to do a little bit of extra work, is the least amount of work that can time they need to devote to actually do that work. So I think, yeah, technology can be harnessed to basically improve clinicians' lives. So that is already happening. A lot to do yet, but I think we are definitely on the right track.
Absolutely. So that joy will be brought back to practice, right?
So, looking ahead to the next 5 years, what do you see as the most transformational changes in clinical quality and population health? And how can organizations prepare today to stay ahead of that?
Thank you so much for that question. Very great question. And if we look today, where we are today, and in fact, look backwards 5 years, how were we doing 5 years ago and getting to where we are today? In the next 5 years, I will tell you that organizations that will win are organizations that, as we are today, they are being more futuristic. They are thinking ahead of time. They are investing in data. They are investing in the people. They're also investing in technology, right? So it has to be any organization that will look into process, people, and technology. Empower your people so that they will be able to thrive during challenges and be creative and urgent with problems. Plus, knowing that healthcare is dynamic. What is working today may be obsolete in the next 5 years. So when you build with that in mind, to know that for you to have competitive advantage over others, you need to differentiate yourself in the market. And differentiation comes with creating value. What is the value that you will bring to the table that others are not capable of bringing that value to the market? When you do that, you will stand even in the next 5 years, and don't play catch up. That is my advice for organizations. Don't sit down and wait for other people to do new things. Then you play catch up. By the time you're playing catch up, you have already lost your competitive advantage. Because healthcare is not waiting for anyone. We need to go. We need to move at the same pace, at the momentum, and that level of momentum that processes will continue to evolve. Technology, documentation, as we said, it's no longer going to be what it used to be. Plus the people, because you can never achieve all this without having a team that will withstand, be resilient, be a kind of a data-driven team that will be resilient, that will be creative, that will help you think into the future, futuristic, right? And know that the market will continue to change, but only those who are proactive will have the advantage of winning in the future. So 3 things: invest in the people, invest in technology, invest in your data. You will stand the test of future, even in the next 5-10 years. Yes.
Great. Thank you. So just sort of clicking back to the first part of the question, I mean, how do you see the sort of lay of the land? This is you putting on your prediction hat, I guess. In the next 5 years, do you see any transformative changes coming in clinical quality and population health compared to where we are today?
Oh, yes, definitely. And we are seeing it already today. Before now, clinical quality and population health was more retrospective measurement. But today and in future, we are shifting and continue to shift into proactive intelligence. I do not really want to sit down because healthcare is moving into past visit, claim, and past outcome. We are looking into the future, utilizing the data and predictive analytics to look at what is going to happen. In fact, to predict who is the individual that will use ED, who is that person likely to be admitted and readmitted, so that we will use the information we already have. Develop programs that will prevent that individual even from being sick or being admitted, or even from preventing them from being readmitted. So clinical quality, population health, it's going to be more proactive. And we will ask it will no longer be, how did we perform? Because that has always been the question. How did we do last year? Of what importance is that? We need to start asking, who needs our help right now? So that we can invest in them and make them live healthy and improve their health outcomes. So there will be more transformation happening, not only in data, but in the culture and mindset of individuals that work within clinical quality and population health. To understand that quality, it's no longer only compliance, but a business strategy. That is a huge transformation that will happen.
Right. And business strategy and changing lives, right?
Yeah, changing lives, because you are in the business of improving health outcomes of individuals and measuring purpose, right? Why are you in the space in the first place? That is the question that everyone that work with the clinical quality and population health should ask themselves. What fuels your passion? And for me, it's ensuring that health outcomes of the individuals that we serve are improved. And that's priceless. And also understanding the fact that behind every data point is a human story. Whenever that you have both mindsets, you will put in your best to ensure that the population you care for live their best lives.
Wonderful. That's inspiring. So, Dr. Stella, thank you for our fabulous and insightful conversation. You've helped us see that quality isn't just a metric; it's a movement. So, as we look towards 2026 and beyond, the message is clear. The future of value based care belongs to organizations that integrate precision, technology, and empathy all at once. So that brings us to the end of this episode. If this episode resonated with you, please follow Care Decoded, share it with a colleague, and let's keep decoding care together.
Thank you.